Okay, I think we'll get started. Welcome everybody to another one of our Poultry Health Research Network seminars. Today our guest speaker is Dr. Fernando Salgado Bierman. And he's going to be talking to us today about multidisciplinary and interdisciplinary realities of poultry medicine. I'm just going to give you a little bit of a background on Fernando's education and his interests, and then I'll let him take it away. Before I do get into that, just a friendly reminder that in 2 weeks' time we do have our Poultry Health Research Network Research Day. That's happening at the Arboretum Center. That's Thursday, November 7th. And it's an all-day event. Registration is free and lunch is provided, so check out our website, PHRN.net, to find more details and to register there. So back to the seminar at hand. Fernando graduated from the University of Guelph in 2012 with a Bachelor's of Arts and Science with Zoology and Ethics and Life Sciences minors. He graduated from the Ontario Veterinary College in 2016 and started with Maple Lodge Farms as a hatchery veterinarian. Currently, he's the manager of veterinary and breeder services for the hatchery division. His interest in poultry lies in pathology, epidemiology, and production medicine. His main clinical veterinary focus is on broiler breeders and hatcheries. And aside from all this, his hobbies include gardening and cooking. Fernando, take it away.
All right, thanks for the introduction. I'm going to talk to you a little bit about multidisciplinary and interdisciplinary realities of poultry medicine. Maybe a little bit different angle of medicine than what you may have typically gotten before. So before I jump into this, I kind of want to talk a little bit about some theoretical aspects of what is this multiple disciplinary work. So in the research around this, they talk about the multidisciplinary work spectrum. There's different degrees to this. I'm going to focus on two of them, which is multidisciplinary, and that's when two disciplines are working side by side, but they're not really integrated in terms of the techniques that they're using, the terminology that they're using, but they're still working together towards the same end goal. And then there's interdisciplinary, where you have different disciplines working very closely together to the point where the boundaries of one discipline and the other start to blur. And we have examples of both of these in poultry medicine and poultry production, which I'm going to talk about with some examples later on. A little bit of a disclaimer, I'm not advocating here that we need multiple disciplinary work all the time. It's not always needed or not necessarily the most effective way to solve a problem. Sometimes one expert can quickly solve a problem. However, sometimes it is the case that we do need to encourage multiple disciplines to work together, and we need to be ready for that. So why should we even care about this? I think the poultry context is getting more and more complex. There's mandates for reduced antibiotic use, both from the industry and from regulatory bodies. There's a bigger focus on using best management practices to achieve health outcomes rather than antimicrobial use. There's also the fact that we're focusing more on management. There's lots of aspects that go into management and preventative health that requires a huge range of expertise to be involved. And an example of that is promotion of good gut health. There's so many specialty fields and subfields in that, and you need a bunch of people working together to actually get a cohesive program in place. There are barriers to this multiple disciplinary work. First and foremost, protecting professional territory. Veterinarians are extremely guilty of this. I think one of the most classical examples in the industry is, veterinarians and nutritionists at loggerheads over certain issues, or one blaming the other. And there's also sometimes a lack of coordination between different areas of expertise. That could come from the fact that people are working, we don't have an integrated system here in Canada. It's quite dispersed, so sometimes people are working with different companies. There's not central coordination, and that can create barriers. And there's also a lack of independent and extension research, and we're often reliant on either proprietary research, authorities saying what's important, or research from the manufacturer. So it'd be nice to get some independent research out there. So I'm going to talk a little bit about some case studies or examples of what I've experienced in the last 3 years of practice, where we need to incorporate different levels of expertise, where that succeeded and where that has gone wrong. So an example here is feed. I have two examples with feed because it's a really good area that shows where a lot of these multiple disciplines can come together to be very effective. So there's a barn that has a history of soft stools to diarrhea reoccurring rather frequently when they enter into light stimulation. Light stimulation is when you're getting the broiler breeders ready for production, so you're increasing the hours of light, you're increasing the intensity of light to promote the onset of lay. And so it is a bit of a stressful time, and sometimes with that stress you can induce a bit of flushing or soft stools or diarrhea. And historically, that's just been treated as a prevention with BMD. However, with the push to reduce antimicrobial use, we want to see if we can use essential oils and probiotics and other gut health promoters to try and alleviate that problem. So we're kind of attempting these new interventions on farms. And so the issue here is I knew the theoretical modes of action and the different products that were available, but the limit of my knowledge was I wasn't sure what people were seeing as effective in the field. There's very limited published clinical trials or studies that test different products against each other. So what I had to do at this point is then to consult with a nutritionist to figure out what is the optimal product and blend of products based on their experience, because they're using these products on a daily basis and they'll know which ones work better than others. So that was an example of collaboration here, but outside of this example, we can take a step back and see that there's a huge opportunity for collaboration and coordination between veterinarians, nutritionists, and academics when it comes to these issues in gut health, especially for enteritis or treating stress or promoting gut health during times of stress. The veterinarians need the nutritionist expertise on gut health promoters and antibiotic alternatives. And then there's a place for academia to provide independent research to fill knowledge gaps in these areas. A key point here is what is the interaction between probiotics and essential oils? I hear some cases you can use them together, but there's research that shows in other fields where there is negative interactions, where the essential oils can actually negatively impact certain types of probiotics. So that field or that knowledge hasn't been fully fleshed out. So there's a spot there for further research, just as an example of a knowledge gap that can be filled. And the veterinarians can provide industry and diagnostic expertise as well as direct feedback from what's happening in the barn by monitoring stool quality, looking at intestinal health and gut health and other health parameters in the flock. So another feed issue that's coming up that's even more complex and will need more players involved to solve it is an issue of intussusception. There's a bit of a concern over intussusception during pullet development. For those who don't know what that is, intussusception is when one part of the intestine kind of ratchets over the other parts of the intestine, and it can lead to the death of the area of that intestine, the tissue there, because it cuts off the blood supply, and it can also lead to prolapse. So it's not a good condition. In a general sense, there's two main types. You have your cocci-induced, and that's easy to treat, not really going to talk about that. And then you have your non-specific enteritis, which poses the biggest challenge. And this is multifactorial and difficult to control. So what is this non-specific enteritis we're dealing with? Our hypothesis is that it's associated with feed restriction and stress. However, we don't see this in all farms that do this. And why do we see it in some farms more than others? I'll get into those questions a little bit later. But feed restriction is good for flock uniformity, and that promotes healthy flocks and lay. Uniform flocks are healthy flocks. And days off, however, conversely to that, days off feed can negatively affect gut health in the pullet barn. So you're trying to balance out these two competing effects. Ideally, we'd have more days on feed, and just to throw it out there, I think the future is likely everyday feeding, but we're a ways from there. But this will throw in a whole bunch of challenges and complications, and we'll need a team approach to solve this. We'll need to integrate knowledge from multiple people to actually have an effective plan. So we need the farmer there because they're going to know their own equipment, their feed hopper, how long that takes to fill, and their pan management. One of the things that's often overlooked when we're talking about nutrition and gut health is feed distribution. It's important to have really good uniform feed distribution in the pullet barn. Because if you don't have uniform feed distribution, you have different birds eating different amounts of feed. And you can have the best feed, the best nutrition program in the world, the best feed allocations, but if your feed distribution's messed up, some birds are not getting too much and some birds are getting too little. And this actually takes a lot of fine tuning and a lot of time in the barn and a lot of experience with your own equipment to get that right. So we're really relying heavily on the farmer for that part. We need the nutritionist potentially to formulate lower density feeds to provide sufficient bulk, because you need enough feed to fill all your pans if you're going to go to everyday feeding or have more days on feed. If you have higher density nutrition in your feed, you don't have the same bulk, so you can't necessarily get good distribution with that less feed. So that's why we need to bulk up the feed and have a larger feed volume. But that also affects a number of other things that are beyond my comprehension, and that's why that goes to the nutritionist. The veterinarian role is there to monitor gut health and monitor the health of the flock overall and make sure that there's no negative impacts. We have a breeder service technician, and they play a very key role. They need to weigh the birds, flesh the birds, and assess how the flock is doing in terms of the performance on the production side of things, because then they'll use that information to fine-tune the feed program, increase the feed by a couple grams, and make recommendations for further feed allocations. The nutritionist and veterinarian then have to work together to figure out what is the best supplements or additions or gut health promoters to try in the feed program. And lastly, there's a role for academia here, and because there's a lot of different factors that go into good feeding, we need to compare what is the most effective or what are the most effective solutions in terms of feeding systems, because there's a variety of different feeding systems. There's chain feeders, pan feeders, broadcast feeders, and in those, each categories, there's numerous types of different models. So we don't really have a good idea as what is the best system for that, or can all of them be good as long as they're managed correctly, and what are those factors that allow people to manage them correctly. And most importantly, we're doing this all based on a hypothesis that this is associated with feed restriction, and that's something that needs to be further investigated and fleshed out, whether it's through meta-analysis or novel research. The next example I'm going to talk about is lights. So a producer is observing aggression issues post light stimulation. And so we went into the barn and we found out that the lights were measured to be 40-foot candles, and the recommendation is between 5 and 10-foot candles. And also the light color was too cool. We want a warmer spectrum light for the broiler breeders. But this was puzzling because it was installed by an experienced contractor. So why did we get this problem? Well, in digging a little bit further, we found that this producer had an issue with floor eggs historically. And if you're not familiar with broiler breeders, floor eggs are like the bane of your existence. This is when the hen is laying eggs in the floor instead of the nest. And that causes issues for the farmer because he has less hatching eggs to send to the hatchery. It's more labor intensive if the percent of floor eggs get really high because you need to spend most of your day walking to collect these eggs. It hurts the hatchery because you get less hatchable eggs. Your egg flow, you're not getting the eggs you predicted you'll get. The eggs you get might have higher rates of infection if you're getting the floor eggs. So it has a lot of downstream effects and it's very negative. So it's quite reasonable that this person would want to avoid doing that. And they heard the advice that you need to make sure you have good illumination so you don't have dark spots so the hens don't go to the dark spots in the scratch area to lay the eggs. So it came from good intentions, but there's different ways to achieve this. So what could have prevented this? This would have been a good opportunity for multidisciplinary communication here. We could have brought in a veterinarian or a service person to talk with the contractor to share the expertise to set the parameters. Because the contractor, I'm not trying to say that the contractor did the wrong thing. They did an excellent job. They achieved the parameters that they were given, but the problem is they just got the wrong parameters. So if there had been that multidisciplinary approach and we brought in other experts when it came to the lighting, we could have avoided this problem altogether. There's things though that the contractor knows that I would never get involved with, such as the type of light, how you're going to wire it, how you're going to hook that up to your controller, and what that integration process is. That's beyond me. So we're not really merging our respective fields, but we're working together to achieve the common goal. Air quality is extremely important, and there's different types of ventilation that you'll run in a barn. When it's really hot, you'll run your summer ventilation, which is often tunnel ventilation, where your ventilation at a maximal rate. When it gets colder and you want to conserve heat, you'll run your winter ventilation, which is more of your minimal ventilation in trying to conserve heat in the barn. And we need to ventilate barns primarily because the birds produce a lot of water, a lot of moisture. So we're trying to remove that moisture. Too much moisture can lead to problems of bad litter quality, elevated ammonia, and dirty eggs. And these can have downstream effects onto bird health and hatchability issues too. So that's why we care. So I got a report, and what they were observing in the barn was increased lameness, increased bacterial infection in the hens. The increased lameness was in the males. There was an increase in dirty eggs too observed at the hatchery. And we went to the barn and we saw that it was wet and caked litter was the root cause of all this. So the temporary fix is we gave some antibiotics to help the males recover from the infection, and then we added new litter new shavings to cover up the bad litter. But good ventilation equals good litter, and we want to, at this point, use collaboration in the future as a preventative. And there's different experts that you're bringing in at this point to collaborate on good ventilation. So when you're building a barn, you want to make sure you're getting expert advice on actual poultry ventilation. You want to be able to calculate your exhaust capacity. There's a whole lot of details that go into that. Your inlet location and style. There's a variety of inlets available on the market, and some work better than others. Again, this is a good area for research if you want to compare the efficacy of inlets or the different management practices needed for the different styles of inlets. And barn tightness. So this is how well you can create negative pressure in the barn to draw in air to have good ventilation. If you have too many cracks in your barn, you're not going to be able to seal it up enough to draw air in to have a good airflow in order to properly ventilate your barn in a nutshell. It's a little more complicated than that. So that's what we want to do when we're building the barn. Once the barn's already built, we want our technicians there to monitor air quality. So they'll do ammonia readings. The farmer and the technicians will assess litter quality and look for spots in the barn where litter quality is deteriorating. And that's an indication that that spot may not be getting proper ventilation or good airflow over that area. And lastly, smoke testing is very good to actually verify that all these parameters have been set up correctly. So you're bringing in a whole bunch of these different areas of expertise and different people that have these different skills. The picture here is of a smoke test. Don't know if I can, there's a pointer, but essentially it's hard to see right here, but there's a bunch of big smoke cloud going across the ceiling here. And this was the first test that we did in the barn with their settings that were already there. And what ideally you want is that air to come in, go across, land, and circulate, but the air was just coming in and going across the top of the barn out. So this, even though in theory this barn was really set up right, so we had the engineers and all that expertise there, we hadn't actually tested it out and fine-tuned it. So we hadn't brought the whole team in yet, and because of that, we failed initially here. Space, I believe this is so space, this is the last kind of case study I'll kind of give you, is we're having increased chicken consumption. There's increased demand for chicken, so barns are being filled to capacity, so there's a decrease in nest space, so that can increase the risk of floor eggs, and that can lead to hatchability issues. Again, with this filling barns to capacity, we might be using the maximum recommendation for feeder pans, even though they'll be optimally effective at a slightly lower rate, and this can cause uniformity in production issues. So what are we doing in the industry to deal with this? So we're assessing barns prior to transfer to make sure that they have adequate pans and adequate space and make recommendations accordingly. But to do this, we're relying on the practical experiences farmers and breeder service to know what is the actual maximum number of birds we can put around different varieties of pans, because there's many different companies that are selling different pans, so each one is a little bit different. And lastly, there's been good collaboration with the Feather Board to highlight this issue to producers. They've updated their contract forms, and this is interesting where we can get kind of a regulatory instead of a science, more of I guess a social science aspect involved, where on their contracts they're actually seeing the issues in their barns that are highlighted because they're reporting all these parameters to the Feather Board, so they know it when they're filling in their allocations. And so they'll have to do a corrective action in order to fill the number of birds that they actually want if they're exceeding any of these capacities of nest space or drinkers or feeder pans. So it's a collaborative approach there. So the last thing I want to talk about is practice adoption. So one thing that, because I'm starting out new in the field and I wondered about is there's books here that tell us exactly what to do. And you would think everyone would follow the book and follow exactly what to do and would all have same results and it would all be excellent. But that's not the case. And there are good reasons why that's not the case, but we might not all know what all these reasons are. So we ask, why do some farms perform better than others? And why do some farms adopt best management practices or changes to best management practice better than others? And I don't have the answers to these questions. I can make some guesses that some of these barns might have invested in better technology. Some barns might have better staff, better egg pickers, better managers, better barn staff. Some barns might have received better service or instruction historically, and that creates a bit of a difference. But one thing we don't know is social determinants. And so we know that social factors are known to affect outcomes across fields. Health outcomes are known to be affected by education status, economic status, reward versus punishment motivation, and what you consider to be a respected authority. So we can clearly see how some of this would impact how willing you are to change your practices or adopt to new BMPs. We're just scratching the surface of this in agriculture. I'll show you some examples below. But what's interesting is the Canadian context is very unique compared to the rest of the world because we do have a quota supply managed system. So there's a lot of factors in there that you don't necessarily get in other areas. And I think here's where we have an opportunity to collaborate with sociologists to understand why we've been failing for so long to get key BMPs adopted. I'm just showing some papers I've copied off the web here to illustrate why this is so important, why this kind of research is really important. And if we see this paper here on the top left, knowledge and attitudes towards food safety and use of good production practices among Canadian broiler chicken producers. They were looking at people's responses to new on-farm food safety programs and why people would be more willing to adopt the practices and not. So these on-farm food safety practices is a culmination of a bunch of people's research, a bunch of your research, a bunch of industry consultation to get the best of the best program. So it's great that we have that program, but we want to find out why isn't everybody adopting it, or why are people adopting it to different extents or following it to different extents. And one of the findings in here, which was very interesting, is that education on the program or belief that these changes actually mattered and actually made a difference and that bacteria on farm can actually impact the customer at the end result. Knowing that that was actual reality had a huge impact in the producer's willingness to take part of the program. So it really showed that education was key to getting this program accepted on farm and people willing to buy in. Another interesting paper here, again related specifically to chicken, was the information needs, sources, and decision making by hatching egg broiler chicken producers, and they did that study in Alberta. And what was interesting here is that for different types of information, they respected different people as authorities. Kind of like a little anecdote on that is when I first started, I was a little bit taken aback when I would make a recommendation and someone said, "That's nice you made a recommendation, but please check with my feed rep first before we actually do that." I was like, wow, I did all those years in vet school and now I have to get checked. Okay, but in being in this industry longer, I understood that you need to develop that relationship of trust before someone's willing to believe you and take you on that recommendation, because if you're wrong, it can have huge financial implications for them, and it is a livelihood that they depend on. So that level of trust needs to be there before recommendations are adopted. So so what can we do now in terms of adopting these modes of interdisciplinary fields of research? So there are existing models out there that are combining what people are doing in terms of research to applications, and actually doing this in an evidence-based way to bring evidence-based production, evidence-based medicine, but actually implement it in a way that it'll be taken up by the people in the field. And the implementation now can be evidence-based. So we have different, I guess, interdisciplinary fields where people are applying this type of methodology. Learning health systems is something that they do in human health, where there's an example of this in the diagram there to the right, where essentially you use whatever available research there is out there. You create an intervention based on the best evidence available, but it's a combination of intervention. It's a multimodal intervention. So, for example, you take people who need to access insulin or heart medication on a regular basis. So yes, the medication and which medication to pick is an area of research, but then do they have access to that medication? How far away is the drugstore? Do they have to commute to the drugstore? Do they have access to public transit? What are the barriers for them to actually achieve good health? So there's a lot of research going into that field and a well-developed field in human health, but we don't have that same robust knowledge in poultry medicine. And I think that's what we need to go forward in the future and actually be able to adapt to these changes that are happening to us on a really quick basis. If we think about how quickly these changes are happening, we just lost Category 2 for prevention. And soon this year, or in the following year, we may be losing Category 3s for prevention. And that's the time of a year. And we know that some of these other strategies that we've implemented have taken much longer to actually be well accepted throughout the whole industry. So I just want to highlight that we can fall back to people have already done these kind of programs and brought people together and been able to bring best practices to the field, so we don't need to reinvent the wheel here in poultry. So to kind of conclude and bring this all together is that we have to collaborate and communicate to pool our collective knowledge. So we all know a lot and our knowledge will fall across different fields, but we can't know everything. And that's why the best success we can have in poultry in these really complex systems is when we pool our knowledge together and work together. I think the Poultry Health Research Network is a great opportunity for this because you have a bunch of experts across different fields coming together for this type of collaboration. We have the Poultry Industry Council out there that's trying to link industry and academia to further have this collaboration. So I think the environment, the social environment is ripe for this type of work. And we're just there. We just need to embrace some of these alternative methodologies to study the best practices for implementation, to take all that good research that people are doing and get it applied in the field. So that's about it. I want to thank you all for your attention, and I'm more than happy to take questions at this point.
Thank you very much, Fernando. I'd like to open the floor to anybody who has some questions.
So this is one about motivation. So how do you motivate your staff when there are issues that are, should be addressed, and everyone knows they should be addressed, but then whether it's biosecurity or just SOPs or what do you find doesn't work or works? Or
So I find like that's interesting because I guess it depends what your relationship is to that person. I find when we're trying to invoke change in the hatcheries, and I know as a veterinarian, we need to do X, Y, Z to promote biosecurity. This is the outcome we want. But I might not know the nitty-gritty details of somebody's everyday work, so I find the most effective approach is to empower the supervisor, for example, in the hatchery to say, we need this outcome for biosecurity or for chick quality or for whatever. What do you think will be the best way to achieve this outcome? And they'll develop a plan oftentimes and be more interested in actually keeping up that plan. And often it's a much better plan than if I had just said, this is what we need to do, because they understand the nuances of what they're doing a lot better than I do. But then obviously what's part of these systems too is that once you have that intervention, you need to assess it and go back and see what is working and what's not working. And that's sometimes where things fall apart, where we don't have that reassessment period going back to actually see if what we want to do is effective. So then once you see what is effective and not effective, you then have to then communicate again and say, this is what's working, this is what's not working, and either the solution is very obvious, you fix something, or again, you go back into a discussion. So there's a lot of communication involved. It's a lot harder when you're dealing with people who are independent, and I think you have to respect where people are coming from their different perspectives. And I think we do a lot of this collaboration, through the boards and stuff, all over discussion of different protocols and programs and stuff like that already. But it's just kind of bringing more or different expertise to that table or to that discussion maybe to flush out the programs a different way and have a way to objectively reevaluate these programs.
So would that kind of be where the integration system in the US is a little bit different than what we have in Canada?
Yeah. So the US system is integrated, and so they do have these pools of experts within the company. And there's pros and cons to that. The pro is that you have everybody at the table working for the same goal. The con is that when you only see yourself, you can get blinded to what other people are doing, and you might not be able to benefit from other people's insights outside of your organization. So that's why I think we're uniquely poised in Canada, because there's a lot of stuff that we do competitively as companies, but there's a lot of things we collaborate on because we know it helps everybody, and we do have a much better support, I guess, across industry in Canada that way. We're or at least in Ontario, where we are able to support each other when it comes to animal health.
Other questions?
I just have one quick. Collaboration seems to be like the key of what you're talking about. So in terms of your experience, what gap do you see that could be addressed to get us the most return on investment if we're just looking for a starting place?
Yeah, I'd say the biggest gap, I think, is identifying what are, be careful how I phrase this. So I think what we're missing is seeing where are the biggest pressure points or on the industry, and what are the problems that we're actually facing. And I think sometimes these problems are not sexy. Like honestly, like floor eggs and good litter management is not, the most exciting thing in the world, but that's really one of our biggest problems. And I think it's shifting the focus. Once we shift the focus to collaboration and looking at this holistic picture of health, it actually elevates the importance of some of this preventative medicine, and that kind of forces people to go out there and collaborate in order to find the best options. I think in terms of infrastructure, we have the infrastructure there. Like, we have the organizations, we have the communication, we have the networks. We just have to leverage that to figure out what are these big challenges that are not necessarily being addressed, or that we are being addressed but that we need maybe more attention on in terms of research or something like that.
Sometimes I think we like the toys too much. And I was thinking about your litter quality. Litter quality can be managed, or you can spend $80,000 on an air exchanger and have a fancy new toy, and it does it for you, and then ta-da. Right?
Yeah. No, and I think that's a great example there of where we really do need this collaboration, because things are getting extremely technical. And I've seen farms like, I haven't seen too many of the air exchangers, but same idea, but different thing is like weight scales, like in-barn weight scales. If you know actually how to use them and pairing up with your hand weighing, they can be really good, like amazing for keeping track of flock weight. But if you're not using them right and know how they drift and know that you need to hand weigh periodically to make sure that your scales are measuring accurately, it can be horribly disastrous, because you think your birds are one weight and one uniformity when they're another. So that screws up your feed program, and that can throw things off the rail. So yeah, knowing how to use that technology and is very, very important. Yeah. And that comes with knowledge translation. And I don't know if that knowledge is always well translated, either by the manufacturer or by industry or whoever.
And it was interesting you brought up the sociology aspects of it as well. I've never really kind of considered, the science of implementation. Along that topic, you did mention some barriers to improving poultry health. What would be some of the key barriers you want to break down to improving that?
Yeah, I think one of the things we would be helpful to learn is what's really motivating people. Because when I first came into the industry, I heard a lot of times, oh, it's always about money, it's always about the bottom line. But then I was talking to some people, and some of these issues are actually very emotional. They're very taxing, and I can relate where they're coming from. For example, a floor egg issue. Someone that has a high percentage of floor eggs and has to be in their barn at all hours, walking the barn constantly to pick up eggs, and is really worried about the financial impact on their farm. That's very mentally draining, and they're willing to take a loss at that point in terms of income to deal with this issue. It becomes more of an emotional, I'm not getting to spend time with my family type of issue. So I was surprised how complex and multifaceted people's needs are, and especially different stages in life. We have people who are just coming into the industry and people who are leaving the industry. So their perspectives are different because one person's looking at succession planning and another person's looking at just coming in. And again, they're going to value things differently. And I don't think we have a good idea of what people are valuing. I think we make a lot of assumptions, but I don't think we've ever tested those assumptions.
Very good. Any final questions for Fernando? Okay, thanks again, Fernando.
Thank you all for your attention.